The University of Kansas Cancer Center is a leader in research and patient care, continually working to eliminate the burden of cancer in our region. And now we are one of just 67 cancer centers in the United States to be awarded National Cancer Institute designation.
For scientific excellence.
For discovery and development of effective approaches to cancer treatment, prevention, and control.
For delivering medical advances to patients and their families.
4 primary research areas make up the University of Kansas Cancer Center's research organization, known as the Kansas Masonic Cancer Research Institute.
A prevention program is absolutely essential for the Cancer Center.
What people need to understand is yesterday's clinical trials provide today's standard of care.
NCI-designated cancer centers represent the standard of excellence, not only for research but also for clinical care.
There are lots of places that can administer wonderful care anywhere in the country, but when research is coupled with the clinical enterprise, it means a patient who's tried almost everything else has newer options that aren't available except at these bigger centers.
In the context of clinical trials, being able to attract these folks to our institution, folks who have national, international reputations for being experts in the clinical evaluation of promising new therapies, will enable us to attract the most cutting-edge drugs for the treatment, prevention, control of cancer.
NCI designation is very, very important for us. We actually look at the potential recognition that NCI designation brings, the opportunities that it creates for recruiting strong new researchers to the program, the recognition that it gives us in the community, the legitimacy that it gives us in the community as we work with members of the community to advance cancer control efforts.
We provide access to prevention trials in which we are able to study not only drugs that may have less side effects than tamoxifen or raloxifene, but also behavioral therapies like weight loss, as well as natural products and vitamins that look interesting for breast cancer prevention.
Having an NCI designated cancer center will create opportunities for cutting-edge research conducted at our institution to be made available to patients. And one of those examples is cutting-edge research that's translated to new drug therapies, and those therapies advanced to clinical trials.
One of the projects that we have recently developed is looking at Native American populations and African Americans, looking at their genetics in colon and see how they will respond to a dietary fiber.
So the Molecular Libraries Initiative is an NIH network for high-throughput screening of chemical compounds for starting points in drug discovery campaigns.
And now we can discover new drugs coupled with the biology and say, we can go after this aspect of cancer cells that nobody else has gone after.
We have to learn to prevent this disease, and so the future is very bright for prevention. It's more important to prevent than to have to cure.
At the University of Kansas Cancer Center, scientists in translational research work to develop new cancer therapies based on an understanding of the cellular and biochemical mechanisms of disease. In other words, they translate discoveries into drugs.
Cancer is not a one-size-fits-all area for treatment. When a pathologist will look at a tumor, they can diagnose it as an ovarian tumor or a breast tumor or a colon tumor. But from a molecular standpoint, we can delve deeper into the tumor and find out that it's very unique. Each of those tumors are very different. So instead of saying you have an ovarian tumor, we can actually divide that molecularly into many, many different classes. And based on that definition, we can then try to select treatments that will be more effective for that individual person and that individual tumor.
Our goal is to break new ground in cancer care and research through promising scientific discoveries and treatments that ultimately lead to a cure.
The NCI designation here will confirm the fact that the patients will be receiving top-notch cancer care, not only through the standard of care that we provide, but also through cutting-edge clinical trials.
We're recognized nationally and internationally for our expertise, and so if you're getting the same therapy here as you're going to be someplace else, there's no reason not to stay home.
The KU Clinical Research Center offers everything necessary to do outstanding clinical research and patient care under one roof.
We know that the only way that we make advances in medicine is through clinical research. So our expectation is that we're going to be at the cutting edge of clinical research to ultimately improve standard of care for our patients with cancer.
No one knows whether or not a brand new drug will or won't work. That's something that we have to find out. What is true though, and what we offer to patients, is hope. The hope that something new may help when they didn't have that hope before.
The Midwest Cancer Alliance links the discoveries made in the lab at the University of Kansas Cancer Center to a region-wide network of hospitals and healthcare organizations. This collaborative effort helps advance the quality and reach of cancer prevention, early detection, treatment, and survivorship methods to patients throughout Kansas and western Missouri.
And we've had thousands of cancer screenings in the last 2 years, all with our partner sites coordinated by our outreach coordinator in the Midwest Cancer Alliance. So that by itself is nothing short of amazing. Dr. Jensen had a vision that this would be a regional effort, and the Midwest Cancer Alliance was launched to pull different healthcare systems practitioners from the region into this effort. The Midwest Cancer Alliance has been the outreach arm for the Cancer Center. Our partners have been tremendous in their support of this effort. And we couldn't thank them enough for coming to the table the way they did.
It's a key part of having an outstanding quality of life, knowing that the Cancer Center is there for you if you need it. Half of all men and a third of all women are diagnosed with cancer at some point in their lifetime. And so, knowing that world-class expertise is available for them, I hope is very comforting, and I hope people never have to use it. Achieving National Cancer Institute designation would not have been possible without the tremendous support of our community. We thank you for helping build a world-class cancer center for our state and our region. But this designation is just the beginning. The legacy of the University of Kansas Cancer Center endures when discoveries made here benefit cancer patients everywhere.